Two problems with that. For the first 2-3 weeks, you go nuts. I've tried it. Like Superman. But the half-life is so short, the levels start to drop. Then by about mid-cycle, there's another 3 weeks, you're sort of flat. Last 3 weeks, you feel like crap. So because of the half-life, I don't like bolus injection of 1,000 milligrams. And the first 3 weeks, you start to see very high rise in hematocrit levels. So you get a super peak, then flat and drop. So the patients go like a yo-yo, And it's not a good feeling. You want to be consistently nice. It may not be fantastic, but you want to be fairly consistent. Every morning you feel good, every day you feel good. Not 3 weeks feel great, 3 weeks okay, and 3 weeks right? So that's why I don't like Nebido. Now, having said that, overseas you have propionate, which is shorter acting, and actually propionate is not bad. I have not found a good source in Malaysia, but it's a twice a week 50 milligram injection. I tried it on, I have a huge group of bodybuilder patients. It takes a lot of commitment to inject yourself twice a week. Okay, why twice a week? Again, the problem with the half-life. Okay, how many here willing to, okay, if you can, if you see the literature, it says IM, but you can do subcut. How many here willing to inject themselves twice a week? Okay, so tell you, bodybuilders' commitment is such, they inject daily, small doses daily, get fantastic results. But unless your patients have that kind of commitment, I do not like a single bolus every 10 weeks. I do use Nebido for ICU patients, HIV patients, because where compliance is poor, elderly, home care patients, those bedridden patients, where I can't trust them to use a cream. Okay. Last one, you asked me cream. Okay. Cream, okay. Pro. The dose is adjustable. Okay. I've never met two human beings, male or female, who require the exact same dosing. So my problem with most commercially available hormones is I can't adjust. Any two of you think anyone sitting here next to each other has the same hormone requirement? It's not. You can't. You will each have individual hormone requirements. So I like cream because it's customizable. What's the flaw? Two things. Absorption is about 20%. So if you see cream, you're going to say testosterone 100 milligrams. How much are you actually getting? You're getting 20%. And you have to really educate patients because you have to apply the correct part of your body. You apply on your palm or your hand, you're not going to get anything. So one, you really, really need to apply it correctly. Number two, depending on how they apply, they can get a variable dose. So I tell them to be consistent. If you're applying it to your scrotum, apply every time the scrotum, inner arm, inner arm. It allows me to judge how well they're doing it. I sometimes do a level 2 hours after, not because I want the level, it's just I want to see compliance. I just want to see how they're doing. Okay? Okay, what's the major downside? Okay. Compounding is not a very regulated industry. It is regulated, but the quality control between different pharmacies, I have, okay, this one, maybe Peter or someone can answer this question. Is there any comparison? That means, okay, you do this way, but we're all on the same benchmark. I don't think there's any regulation for that, right? Tarakan. Okay, so I have a problem with this. My problem is pricing does not reflect what you get. So quality of manufacturing seems to be all over the place. I worked with quite a few pharmacies. This is me purely telling patients, please God, don't follow my method unless you're very confident about it. I classify it as BMW, Honda, and Myvi. Okay? My answer for Myvi, that means you got a super cheap drug, is that most of the time you pay Myvi price, you get Kapchai product. So I usually say no Myvi. Honda, okay, roughly you pay Honda, you get a Honda price, you pay BMW, you get a BMW price product. My patient load may not be yours. Mine tends to be word of mouth, tends to be what the Malaysian government calls a T20 segment. They are not so sensitive to price. They want good products, good results, and that applies to me because unhappy patients are hard to deal with. So answer your question on cream. I use BMW. You need to be sure of where you're getting it from. That's a downside. Plus side, you can adjust the dose to customize each and every person in this room. Okay, did I answer the question? Yes. Okay, anything else? Okay, so for example, okay, women, easy. Let's say I give you estrogen and you come tell me, hey, my breasts look nice and full, I feel great. Fantastic dose. You come and tell me my breasts hurt like hell, my nipples painful, right? Okay, I'm overdoing it. The problem is it's symptomatic. Some women like nice full breasts, look good, I can put out a little bit of discomfort. Some women like nipple, little bit sensitive, and like. So you're going to adjust. So you have to know what each hormone does, and then you're going to adjust it. Now, if I have someone and comes and tells me my symptoms are stagnant, but my hematocrit levels are going up, can I bring down the dose of testosterone? Okay, can. I started 100 milligrams. I reduced it to say 75 milligrams. Or I gave him a hormone holiday. Maybe I gave him for 5 days, I stopped for 2. Some patients I give a hormone holiday. You bring it down. If their symptoms are still well controlled, but the hematocrit side effect is coming down, fantastic. Let's go with that. Okay? But I can't do that with any other form. The injectable can. I used to use a lot of injectables last time until for some reason known only to God and the Malaysian government, they took it off the market. So Thailand, I'm not telling you to do this, and technically it's illegal. But on Shopee and Lazada, they sell Thai products. Okay? And they're very, very cheap. But the problem is quality is not consistent. I had some really good stuff, and I got stuff that patients kind of complain, flares, redness, allergies. So use at your own risk. Bodybuilders are not the wealthiest segment. Okay, they're not. They're very price conscious because they're using a lot, and they stack. So if I'm stacking 5-6 hormones together, I can't use cream. I need fixed dosing. But this is for very particular segment. These are pro-level bodybuilders, and they know how to monitor side effects. They are very, very good. They have off cycle, down cycle. So if you're doing stacking, you're doing 5-6, yes, I do use drug. Patient buys at their own risk. Shopee, Lazada, I leave you to figure it out. If I tell you, then tomorrow Malaysian government come chari me. This one is a big one. Diabetes is our growing #1 metabolic disorder, right? I think it's a Malaysian government website. Everybody says diabetes. So there are 2 papers I put up on this. The first one is a RCT, okay? So it's a combination 5 studies. Now the problem with RCTs is, the problem with meta-analysis, this is a meta-analysis, 5 papers, is if you put garbage in, you get garbage out, right? It's not a RCT. RCT is a single paper. Meta-analysis, you're looking at all papers combined together. If the author did a good job, you got 5 good papers. Did a bad job, you got garbage in, garbage out, right? So they looked at 5 randomized control trials, men with early type 2 diabetes. And these people had low testosterone with diabetes, which is the classical definition of metabolic syndrome. Sorry, one step back. How many here know metabolic syndrome definition?